Right. Well, good morning, everyone. On behalf of the Wood County Committee on Aging, we thank Dr. Jessica Ickes for joining us today. We are presenting our program on cold and flu season, and Jessica in medicine practice. So please welcome Jessica.
Thank you so much. Thank you for letting me speak with you all today. Like Danielle said, I am a resident with McLaren St. Luke's Family Medicine. And today, because we are rapidly approaching cold and flu season, we're going to talk a little bit about the common cold and influenza virus. What are the similarities? What are the differences? What can we do for these if we were to get an infection with one of them? And then also we'll talk a little bit about, we'll touch on COVID-19 because that's a hot topic right now. And then also just talk briefly about telemedicine visits at the end. So we'll start with what is the flu. So the flu is a respiratory virus. It's an infection of the nose, throat, and lungs caused by the influenza virus, either influenza A or influenza B. And it is a virus that is present in respiratory secretions of an infected person. So transmission would be through things like sneezing and coughing, can also live on contaminated surfaces for about 2 hours or so. And that'll be important when we talk about prevention of the flu a little bit later. So symptoms of the flu would include a fever. The fever is usually high, so usually between like 100 to 104 degrees, can even get all the way up to 106 degrees in some people. You can also usually suffer from headache, extreme tiredness and fatigue, dry cough, sore throat, can have a runny or stuffy nose, and have some muscle aches. Patients, it varies on how extreme these symptoms are, and it will depend on your underlying comorbidities and age. Something to keep in mind is that older adults are particularly likely to have more subtle signs and symptoms, so you may not experience, the extreme fatigue like you're thinking and usually associating with the flu. The flu has an incubation period of about 1 to 4 days with an average of 2 days, meaning that you have the virus in you and you can potentially infect people before you know that you're sick. So you can be spreading that during that time. In the general population, it is a self-limiting infection. It has an average duration of about 5 days in the general population as well, but you do shed virus for longer than those 5 days. And this would be considered uncomplicated influenza. So we do know that people age 65 and older, or if you have any underlying chronic illnesses, you are at an increased risk of having complications from the flu. So that would include things like pneumonia, dehydration, and worsening of your chronic medical conditions. So things to watch out for pneumonia in particular would be if you have persistent symptoms, past that 5 or 7 day mark, you would definitely want to be getting checked out, let your healthcare provider know. Or if you were to your symptoms were to start to improve, and then you all of a sudden have an exacerbation of your symptoms, you're getting worse, you're feeling more short of breath, you're, having high fevers again, that would be something that would be concerning for a pneumonia infection on top of the flu as well. So that would be something you would want to let your healthcare provider know about too. So now we'll talk a little bit about how can I prevent the flu. So the main thing is a flu shot every year. So you can get this at your healthcare provider's office. You can get this at a pharmacy, but it is a yearly vaccine, and we highly recommend getting this every year. It is updated every year in order to match whatever flu viruses are circulating that year. So I did list just a couple, the trivalent and the quadrivalent and the components of them for this year. They have long names. Essentially, the trivalent has an H1N1 strain, an H3N2 strain, and then a B Victoria lineage. Whereas the quadrivalent, meaning it has 4 components, it contains everything that the trivalent contains, as well as the Yamagata lineage. And so, getting whatever flu shot you get, it will depend on your age and then any potential underlying comorbidities that you have. So for the age population 65 and older, it is recommended that you get the high dose quadrivalent vaccine. High dose means that it has more of the antigen in the vaccine, because as we age, our immune systems tend to wane. And so that higher dose of antigen will stimulate the immune system more than the regular dose. And that's usually necessary as our immune systems start to wane when we're older. So the flu shot is an inactivated vaccine, meaning that there's no live virus in it. It only contains proteins from the virus that will stimulate our immune systems to recognize the flu. There is also a nasal spray form of the vaccine, which is a live attenuated virus or vaccine, but it's recommended only in a certain population of people. And if you're 65 or older, it would be recommended that you get the inactivated. And so when to get this, so, September, October is a great time to get this. If you miss it in the fall, you can continue to get it through January. Some people might even vaccinate into February, or I've even seen into March before. Sorry, my lights just went off because there's no movement here. And so, just because you miss the fall doesn't mean that you can't get it that season. Other ways to prevent the flu: avoiding close contact with people who are sick, and then staying at home when you are sick. And this is particularly important right now as we're dealing with the COVID-19 pandemic. If you have any, anything telling you that you're getting sick, you have a sore throat, any runny nose, anything like that, feeling like your muscles are achy, just stay home and quarantine until you know if you're sick, if you have something that you could potentially be passing on to someone else. In addition to that, covering your nose and mouth is always very smart. And, we're kind of getting used to this with wearing masks lately. Avoid touching your eyes, nose, and mouth. So the virus will enter your body through any openings in your skin, through your eyes, through your nose, through your mouth. So just avoid touching your face in any way. And again, the masks help with this because we aren't able to touch our mouth when we have the mask on. And then washing our hands. So, and doing it, the appropriate way. So, wetting your hands with warm water, putting soap on your hands, really vigorously scrubbing them for at least 20 seconds. And then using a paper towel to turn off the faucet and then open the door. If you're in a public restroom, you want to use that paper towel so you're not just contaminating your hands again after you've already cleaned them. So those are all ways that you can help prevent it. In addition to that, making sure you're getting some physical activity. So 30 minutes a day can help to strengthen your immune system to help you prevent getting the flu. Make sure we're getting adequate sleep. Proper nutrition, so at least 5 servings of fruits and vegetables every day so that we're getting all of the vitamins that we need to help our bodies fight any infection. And then making sure that we're staying hydrated is also important. So now on to, we'll talk a little bit about the common cold. So, it's a similar respiratory infection of the nose, throat, and mouth, but it is caused by different viruses. So it's not caused by the influenza virus, and it's often much milder than the flu. It's estimated that there are about 200 or more subtypes of viruses that can cause the common cold. So there's a lot of them. Rhinovirus is the most common cause. Symptoms would include things like a runny or stuffy nose. You might have some mild muscle aches and pains, a mild cough, a little bit of chest discomfort, sore throat, and rarely would you experience any headache, fevers, or chills like you would with the flu. So definitely some similarities, but like I said, the symptoms are usually much milder for most patients. And then also along with that, the complications are less common than with the flu. It is spread the same way as the flu, so by respiratory secretions and contaminated surfaces. So remember that the viruses can live on contaminated surfaces for about 2 hours. So anytime you're touching anything, you want to make sure that you're using that good hand washing technique. And then again, anyone with underlying chronic illnesses, or if you're a tobacco smoker, you would be at a higher risk of having more severe symptoms from the common cold as well. So how can I tell if I have the flu or a cold if I were to get sick? So can be difficult to tell if it's the flu or common cold, especially because, we've already talked about how the symptoms can kind of vary. The severity can vary, especially depending on age. You can talk with your healthcare provider and tell them what your symptoms are. There are tests that we can do to see, is this the flu? Is this a cold? Is this COVID-19? And so there's rapid flu tests. And then there's also conventional flu tests for both flu A and flu B. So if you presented to your doctor's office and told them your symptoms and they wanted to rule out the flu, they could, do a rapid test and tell you in office if you have the flu, which would be, and we'll talk about later, important for potential medications for that. And then it's also important, if you get sick, you're going to want to get examined by your doctor to make sure that there's not something else going on, and that you don't have any complications of the flu, like the pneumonia or anything like that. So that would be important. Don't just brush off any symptoms as, oh, I'll get better. And then a little bit about COVID-19. So COVID-19, we've heard a lot about lately, I'm sure. It is a viral infection caused by SARS-CoV-2. It's a novel coronavirus, which is why it's such an issue, because none of our immune systems have been exposed to this specific coronavirus before. And so we're all very vulnerable to getting this. It can present similarly to the flu. So we're seeing a lot of fever, headache, body ache, sore throat, cough, fatigue, GI symptoms like diarrhea. And, this also has a very wide range of presentations. So we can have people who are completely asymptomatic and testing COVID positive. And then we have people who are very sick and very short of breath, testing COVID positive as well. It is possible to have both COVID-19 and the flu at the same time. So that is something to keep in mind too. If you are sick and you test positive for the flu, that does not rule out COVID-19. You'd really want to be mindful of your symptoms and monitoring your symptoms closely, especially how your breathing is doing. If you were having any worsening of breathing, any shortness of breath, especially, hey, I'm walking to the bathroom and I'm becoming short of breath and that's not normal for me, or I can't speak in full sentences without becoming short of breath, let someone know right away, talk with your healthcare provider, and see what needs to be done. Just like with the flu, there are tests for COVID-19. Now the rapid tests are becoming a little bit more popular than they were in the past, but there's still the tests that take a couple of days to come back, and now the rapid tests as well. So, just always keep in mind, if you're sick this season, don't rule out COVID-19 and really monitor yourself closely. And wear a mask, as I'm sure we've all been doing, but just, you want to protect yourself and you want to protect others from you if you were potentially infected. So what should I do if I get sick this flu season? So, rest, listen to your body, make sure you're getting plenty of rest, make sure you're drinking plenty of fluids, especially if you were having high fevers or anything like that, which can dehydrate you pretty quickly. Avoid any alcohol or tobacco use, which can, prolong the length of time that it takes for you to recover from an infection like this. Humidify any dry air. So use a humidifier in your room to, make sure that the air that's passing in your nasal passages and in your throat is a little moist. Gargle and use saline nasal spray for comfort. And then make sure, like we talked about, make sure you're talking to your doctor about testing and ruling out COVID-19 in any of these situations. There are some medications. Most of them are for symptomatic control and relief. So there's analgesics like Tylenol and Motrin. These can help with fevers and any aches or pains that you might have from the infection. There's antitussives. So this can help you to stop coughing if you're finding that you're coughing a lot and you're uncomfortable. Expectorants, so Robitussin, this can help to thin the mucus if you're having trouble, getting out the mucus that could be in your lungs. And then there's decongestants. This can help to reduce any nasal swelling and congestion that you might have going on. There's also nasal sprays, so Flonase. You can spray this in your nose and it will help to decrease that swelling and congestion again. And then there's also antivirals. So this would be something like Tamiflu. If you did test positive for influenza A or influenza B, this could help to shorten the duration of symptoms, usually an average of half day to 3 days. But it does have to be given pretty promptly after you start to show symptoms. So within 48 hours, and the sooner the better. So that's why, if you're starting to get any symptoms, it is important to talk with your healthcare provider, get in for an appointment and get tested. And then there is just a quick little chart here. One more thing I wanted to mention about the medications. If you're buying over-the-counter medications, especially for cold and flu, make sure that you're really looking at the ingredients, because a lot of times, there can be Tylenol in multiple products, and you don't want to be taking over the recommended amount of Tylenol in a day. So make sure you're really paying attention to those labels, looking at the active ingredients, and making sure that you're not overdoing it on ibuprofen or Tylenol or anything like that. And now we can take a peek at this chart here. This just kind of compares the common cold to flu and what we might experience with them. We have already talked about most of these, but this makes it a little bit easier to read. So with the cold, you're rarely going to have a fever. With the flu, fever is usually present and it's usually pretty high. So 102 to 104. That fever can last usually between 3 and 4 days in patients. Headache with a cold is going to be rare. With the flu, you have a pretty bad headache with that. So that's another way to kind of tell the difference. As far as body aches and pains, cold, you might have some mild aches and pains. With the flu, you usually do have some sort of discomfort, aching, muscle aching, and it's usually pretty severe. As far as fatigue or weakness, again, with a cold, it might be mild. With the flu, you could have prolonged fatigue, even after the influenza virus is cleared, for up to 3 to 4 weeks. Extreme exhaustion, usually you shouldn't have that with the cold ever. And the flu, you usually feel pretty tired pretty early on in the illness, and you're going to notice it. With a stuffy, as far as cold goes, you're usually going to have a stuffy nose, sneezing, and sore throat. And then sometimes you will experience those with the flu, but usually every time you have a cold, you're going to have those. Chest discomfort or cough. Cold might be mild to moderate. With the flu, it can be pretty severe, and it's pretty common with every flu infection. Complications of cold, so sinus congestion, you can get sinus infections and earaches or ear infections. And then with the flu, bronchitis, and like we've talked about, pneumonia, and this can be life-threatening. So this is why you really want to pay attention to your symptoms. Make sure that if they start to improve, they continue to improve. If they were to start to worsen, get in to be seen, because you're going to have to be looked at. Prevention of the flu or of cold, really nothing you can do there. But for flu, we have our annual flu vaccine, and then also the antiviral drugs that we talked about. And then for cold treatment, just controlling those symptoms with the medications that we talked about, our Tylenol and everything like that. And then with the flu, we have our antivirals. As long as they're taken within 2 days of the start of your symptoms, then they could potentially decrease the length of time that you're sick. And then, so that's kind of what I have to compare the common cold and the flu, and then threw in a little bit of COVID-19, just because that's something that we definitely need to be considering this flu season. And then I also wanted to touch on telemedicine briefly. So telemedicine has really increased in popularity due to COVID-19, because a lot of people don't want to go out and about. They don't want to go to their doctor's offices and things like that. Just keep in mind, it always is better for us to see you in person. This allows us to give you the best examination that we can, and really the best treatment that we can. If it has to be a telemedicine visit, Keep in mind that, you know, we would prefer video visits over just telephone or audio visits, because at least with the video, we can lay eyes on you, we can do a partial physical exam, see how you're looking, see how you're doing. So that helps an awful lot in our treatment. And then as far as insurance coverage, so I did talk with our biller and coder this morning for the most up-to-date information because it is changing pretty frequently. But most insurance companies have extended coverage of telemedicine visits through September 30th of this year. And then Medicare and Medicaid will have coverage in effect until the public health emergency is over. So, you know, I just ask you to keep in mind that we do prefer to see you in person if we can. But if a telemedicine visit is necessary, that's kind of what we're recommending is for video and not just audio. And then any questions or anything like that, I can take those at this time. Hello.
Hey, it's Tony. Can you just speak real quick to any type of over-the-counter things like airborne or echinacea and how effective those might be?
Yeah, I think that airborne can be helpful. It kind of gives you that boost of vitamins that can help you to fight illnesses like this. So I think that would be a good idea if you start to feel yourself getting sick, or if you've been exposed to someone that is potentially sick, to go out and get one of those things. In addition to that, if you are exposed to someone that has tested positive for the flu, some providers will prescribe exposed contacts like Tamiflu or an antiviral to help prevent getting it. So that's also something to consider and to talk with your provider about.
Perfect. So if anyone does have a question, you are muted, so you will have to unmute yourself. I saw that Danilda would like to share something. Please be mindful, we are being recorded, so if you'd like your camera off, you can go ahead and turn your camera off. Just go in here. I think she's asking a question. Let me just help her.
Okay.
Okay, how's that?
I can hear you now.
Okay, you said to try and get to your doctor within a couple of days if you're running a fever, if you think you have the flu. What happens if you can't get into your doctor?
So
then what do you do?
You could try to, if you can't get in, you could do a telemedicine visit. And like I said, with the video would be preferable to then just over the phone or audio, and see if they can do anything for you. I can't speak for what they would be comfortable, you know, prescribing if they don't have a flu test or anything like that done. But it is better to have some sort of visit than no visit.
Well, yeah. Okay. Thank you.
You're welcome.
All right. Does anyone have any questions at this time? Well, I think we are going to wrap up then. We really appreciate Dr. Ickes joining us today. And on behalf of St. Luke's Family Medicine, we appreciate you supporting our Lively U Virtual Learning Academy. So thank you, and this will be recorded and shared on our website at www.wccoa.net.
Okay, thank you so much for having me and letting me speak with everyone.
Thank you.